Welcome to the weekly Dear Dr. Mao. Today I'd like to talk about the hidden health dangers of mold exposure. Later on in the episode, I will share with you what to do if you suspect that you or your family members may have been exposed to mold. First, let's talk about what mold is. Well, mold refers to multiple types of fungi that grow indoors or outdoors where moisture or water collects. It thrives in damp, warm, and humid environments and can be found in essentially any environment or season. Today, I would like to talk about the more common types of mold that are found indoors, including Cladosporium, Aspergillus, Alternaria, penicillin, and Stachybotrys, sometimes also referred to as black mold. We see this black mold is a greenish black mold that grows on household surfaces that have high cellulose content, including wood, gypsum board, paper, dust, and lint. The way that mold reproduces and spreads is by forming tiny spores that are not visible to our naked eyes. Spores are very hardy and can survive under conditions in which mold cannot grow, such as in dry, harsh environments. These spores travel through outdoor and indoor air. When the spores land on a surface where moisture is present, now the mold can start to grow. This is also where potential health problems arises, especially for immune-compromised people. Think about where else is warm, wet, and dark. That's perfect for spores to land and begin to grow mold. Yep, that's right. In your sinus cavities, lungs, and digestive tract, which are the perfect environment for the spores to take hold. Now, normally with a healthy immune and respiratory systems, when you happen to inhale tiny mold spores into your nose, the villi in your nose, these tiny hair cells, traps and stops the spores from traveling deeper into your airway. Then your immune system produces antibodies to activate your body's troops to attack and destroy the spores, often producing an allergic response. After the mold exposure has passed, you still produce antibodies that remember this invader so that any later contact with the mold causes your immune system to react. This reaction triggers the release of histamine, which causes, of course, itchy, watery eyes, runny nose, sneezing, restricted airway, cough, asthma, and other mold allergy symptoms. Now let's talk about the risk factors that predispose you to mold problems. These include the following: working in an occupation that exposes you to mold, such as water damage and mold remediation, right? People who work in that field, farming, logging, baking, carpentry, fishing, greenhouse work, winemaking, and furniture repairs. Now, living in a house with high humidity is also a risk. Now, if you live near the ocean or by a lake or your indoor humidity is higher than 50%, you may have increased exposure to mold in your home. Working or living in a building that's been exposed to excess moisture. Examples include leaky pipes, water seepage during rainstorms, and flood damage. At some point, nearly every building has some kind of excessive moisture. This moisture can allow mold to flourish. Living in a house with poor ventilation. Tight windows and doors seals and may trap moisture indoor and prevent proper ventilation, creating the ideal condition for mold growth. Damp areas such as the bathrooms, kitchens, and basements are most vulnerable. So, let's talk about treatment if you have symptoms from mold exposure. There are two parts to a successful resolution of mold allergies or severe inflammation due to mold. First is elimination of mycotoxins. The toxins produced from mold infection can overwhelm your body's function, leading to immune system breakdown and can even lead to cancer mutations. The most well-known mycotoxin is aflatoxin, found in peanuts, that may be partially responsible for the anaphylactic shock allergic response that some people have to peanuts. Second is to reduce and stop the immune response and inflammatory process. Part 1, detoxification. When it comes to detox, chelation therapy that's typically used for heavy metals do not work for mycotoxins. Here are 7 steps we take clinically for our patients with mold infection and the ensuing inflammatory response syndrome to eliminate the mycotoxins. First, acupuncture. It is used to activate your liver to break down and excrete the mycotoxin through the gut. Second, skin brushing to activate lymphatic circulation and move the toxins to the drainage duct to be cleaned out. Third, lymphatic massage to aid the process of moving the limbs. Fourth, cupping, which is used to activate and pull the toxins up to the surface of the skin. Then fifth, infrared. We use infrared sauna to induce sweat and discharge the toxins. Sixth, Detox Bath. Our detox kit contains a special formula of antifungal and detox herbs to draw out mycotoxins from the skin. And finally, we send patients home with special herbs to excrete the toxins through the bowels and urine. Part 2, quell the inflammation. I'll be back in my next episode to talk more about how to diagnose and treat the complex multisystem chronic inflammatory response syndrome due to biotoxins, which include mycotoxins from mold infections. I will also give you prevention guidelines on how professional inspectors find mold in your house. Until then, inspect your house and workplace for obvious water damage and mold growth and get it remediated before it becomes a grave hidden threat to your health and longevity. In summary, don't underestimate the hidden health dangers of mold, and if you or your family members have been exposed to mold and have experienced symptoms, don't wait. Seek treatments immediately so that the mycotoxins is eliminated as quickly as possible and inflammation extinguished before permanent damage occurs. I hope you found today's episode helpful. Tune in next week when I'll be talking about part 2 of mold infection treatment, quelling inflammation and prevention of mold in your home and work. Until then, live long, live strong, and live happy.